So now next we have manifestation. So what is manifestation? Manifestation, like if a person have one disease and due to that disease he get another disease. Okay, that's called manifestation. Okay. So like if patient have diabetes and due to diabetes he get the retinopathy. So the disease become will be diabetic retinopathy. Okay. So in that case we need to check the combination code. If there is a combination code available, then we will use two combination code. Otherwise, we will take two individual code. Okay. So what happen in manifestation? There are some condition which we assume that this condition is due to this. Okay. But some condition we cannot assume. So if patient have diabetes and he also have retinopathy, but physician did not mention that whether the retinopathy is due to diabetes or secondary to diabetes. So we will not assume that retinopathy is due to diabetes. Okay. Due to diabetes should be there. But there are some condition which we assume that it should be due to diabetes, like chronic kidney disease. If person have diabetes and chronic kidney disease, we assume it is chronic kidney disease due to diabetes. Neuropathy, nephropathy, gangrene, foot ulcer. So all these conditions, we assume that these conditions are due to diabetes. Okay. So then we have diabetic retinopathy, no explicit like mention. So if he mentioned diabetes and retinopathy, in that case, we cannot assume that this is diabetic retinopathy. Okay. So if physician mentioned diabetes and other manifestation, so in that case, we will use combination code and we will not use normal diabetes code. Okay. And if there are two codes available, okay, suppose diabetic retinopathy, if there are two codes, one for diabetes and one for retinopathy, so your diabetes will always code first. Manifestation codes are always code second. Yeah. So you just go through this table. There are two codes, then always the diabetes will be the principal diagnosis and manifestation will be the secondary diagnosis. And if there is a common single code, then it will be go as a principal diagnosis. Okay. C instruction. So suppose if you want to go Gurgaon, how will you go over there? From here, if I say that you need to go to Gurgaon, catching metro, okay, but you have bike, but you are not aware about how to reach. Then what you need to follow? Google Map. Okay. So if your Google may say that after 500 meter you need to take right. So what you need to take? Straight or left? Right. Right. You need to take right. Till when you need to follow your Google Map? Reaching destination. Till the time you reach the destination, you need to follow the Google Map. So why we are using ICD 10? Or like Google Maps only. Why we are using ICD 10? For coding purpose. Which coding? Medical coding. Which medical coding? ICD 10 CM. That is the name of the book. Why we are what we are looking in this ICD 10? Diseases. Yeah, we are looking codes for diagnosis. So till what time we will search in ICD 10 CM? We did not till the time we did not get the ICD 10 code for that particular disease. Okay. We didn't find that particular code. No, we will follow the ICD 10 as Google Map. So till the time we did not get the our code, we will follow whatever this ICD-10 suggests. Okay, go there, always follow. Okay. So here is the example: stone in gallbladder. So what code we need to search for? Gallbladder. Stone, gallbladder, stone. So where we need to go first? Gallbladder is the organ. Stone. Okay. So always go for disease. I told you na. Yeah. Always go disease first. Okay. So where we need to go? Disease. No. Stone. In stone we need to go first. So here are stone. Are you able to find gallbladder in stone? Gallbladder in stone. Stone? Stone. Are you able to find the gallbladder? Gallbladder. Okay. So what mentioned in front of stone?
Showing bladder only.
No, but bladder is urinary bladder.
Yeah.
N series code, no?
Yes.
So I am not able to find the gallbladder. So there is hint given. So what mentioned in front of stone?
See also calculus.
See also calculus. So that's mean stone. If I am not able to find anything in stone, where I need to search?
Calculus.
Calculus. So I need to go to the calculus now.
Left side.
Calculus. And in calculus, what I need to find?
Stone.
No, gallbladder. I found the gallbladder.
Yes.
So what will the code for gallbladder stone? K80.20. Yeah, got it.
Yes.
So that is the rule we need to follow. C and C also. Okay. C and C also. So we need to search the code till the time we get the diagnosis code. Next guideline is sign and symptoms. So whatever problem you have abdominal pain, you have knee pain, headache, okay, fever, cold, cough, all these are sign and symptom because you are not doctor, so you cannot diagnose.
Yes.
So these are not the disease, but are the symptoms. Okay. So there are two guidelines for symptoms. Okay. So if somebody have kidney stone, so what happens? He will get abdominal pain.
Yes.
So the abdominal pain is not here disease. What is disease?
Kidney stone.
Yeah. And if somebody have kidney stone, it's obvious there will be abdominal pain. Okay. So there is no need to code abdominal pain. If you are coding kidney stone, there is no need to code abdominal pain. If somebody fall and get fracture, he will get pain or not?
He'll get pain.
So it's related to
Yes.
fracture. Okay. So it's a symptom which is associated with the diagnosis. So any symptom which is associated with the diagnosis, we are not supposed to code that symptoms. Okay. So suppose if somebody have leg fracture and he has abdominal pain, is this associated? No. So if there are diagnoses and symptoms which are not associated, in that case we can code both. Yeah. So these are the guidelines. Just go through. If any symptom part of the disease not coded separately. Okay. If it's not part of the disease, code it separately. Okay. Just see this example.
Leg fracture, leg pain. Is the
No, just go through the A, part A, sign and symptom that are part of the disease process. Not if the sign and symptoms are integral part of it, confirmed diagnosis, they should not be coded separately. Okay, leg fracture, leg pain, है ना? So what you need to code only?
leg fracture.
Leg fracture. Abdominal pain, kidney stone.
You need to code
Only kidney stone. And in the next example,
leg fracture, abdominal pain. We need to code on both.
yeah. Any query till now?
No, sir.
Okay. Code an ICD 10 diagnosis only one per medical record. So if diabetes mentioned 10 times in your medical record, you need to code only once. So it's not like everywhere, every time you get a condition mentioned. If you already coded that condition, you only need to code once per medical record. Okay. Now, acute and chronic condition. Acute and
Chronic condition.
chronic condition. So I told you which condition is dangerous, acute or chronic. That day I give you the example. If the manager have 10 people in his team and 2 people are frequently absent, like coming late. So this is the chronic problem. Manager like discuss them with the several times, but there is no impact of that. Okay. Now another bunch, either team of 10 people came, and from that team 2 people start coming late. So that is the major challenge. Okay. So if a person have acute and chronic condition, first we will take if there is check whether there is a combination code available or not. Okay. If there is a combination code available, in that case, we need to use single code. Combination code. So like say acute pancreatitis with acute chronic pancreatitis. Okay. If there is a single code, we take only single code. If single code is not available, okay, then we will code both acute pancreatitis, chronic pancreatitis. But acute will always code as principal diagnosis. Okay, so just check example on your screen.
Yeah, sir. I have one more doubt. Already patient have acute condition in other organ and chronic condition in another organ.
No, no, that is not related to that. Here, okay, yes. So if he has acute condition and chronic condition, then acute condition will be the principal diagnosis. Because your reason for the visit is acute condition, not the chronic condition. Okay. So if somebody have diabetes and then he fail and get the leg fracture, so there is no role of the diabetes because why you are visiting to the physician? Because you have leg fracture. Yes, diabetes will also code because there can be a complication. There is a delay in the healing. So that cannot be reason for the visit. Today your reason for the visit is leg fracture. So in acute systolic heart failure and chronic diastolic heart failure, we have a combination code.
Yeah.
So
If combination code not available, we should choose acute only.
no, we will code both. Acute as principal diagnosis, chronic as secondary diagnosis. Yeah. So in that case, that there is no combination code. Acute kidney failure and chronic kidney disease.
Yes.
Okay. So we will code two separate codes. Yeah. Just go through this table. Any query you found.
The third one and fourth one, additional we have discussed. Acute and chronic combination code available. Use one combination code. If
Yeah.
combination code not available in this case, what should we do?
You need to code both.
Both.
Yeah.
If combination code not available.
Yes. But acute will be the principal diagnosis.
Okay.
Okay.
And the third one, fourth one, acute and chronic, no combination code.
Hmm. Code acute first, chronic second. But you need to code both.
Yes, sir. In this case, we need to code both.
Yeah.
The acute and chronic combination code available.
Then only combination code.
It is not available, to use both codes.
Okay.
Yes.
Suppose if you go in restaurant, they give you biscuit with tea.
Tea.
Okay. Then there is a combination billing.
Yes.
But they give only the tea. Then they will give you, if you want biscuit, then separate bill for it. Okay. Code also. Sometimes what happens that if there is a combination code available, okay, but still they want that you need to separately code it the condition. Okay. So the patient have benign prostate hypertrophy with urinary retention. Okay.
PH.
Yeah. So you have a code N40.0 and N40.1. Just go in your book. Now check. What mentioned? Let's check your screen.
40.1.
Hmm.
Benign prostatic hyperplasia with lower urinary tract symptoms.
So what is urinary tract? Sorry, what is urinary retention? Hmm. I told you two condition. Urinary incontinence, patient is not able to hold the urine.
Yes.
And retention, not pass the urine. So this is a symptom.
Symptom.
So if patient only have BPH, benign prostate hypertrophy, what code we will need to use? N40.0. But he has BPH with urinary retention. So we need to use N40.1. Then what is mentioned? Use additional code. Which symptom he have? So which symptom we have? Urinary retention. This one. Okay. If he have incontinence, then we need to use N39.4. Okay. So here it's saying even though there is a combination code available, but it's not clarified that this is due to urinary retention. So that's why we need to use separate code for additional code for urinary retention. Okay. Then we have late effects. So what is late effects?
That means after a few days we'll
नहीं. Hmm.
after after few days or after a few months we'll get some additional diseases like
No. Suppose if somebody get a stroke and due to stroke he get hemiplegia or aphasia or dysphagia. That's called late effect. So late effect can occur at any time. It can be after few days, few months, few year also. So there is no time frame. Okay. Late effect also known as residual effect. Just check this table. So it's a for code also and late effect. Okay.
yes. The second one, final ICD 10 code, is that correct, sir, or no?
Pardon?
Second one, final ICD 10 codes that CPL late effect,
Mm-hmm.
final ICD code, is that correct, sir?
Which one? Hmm.
It's only number, no, sir. Okay, I6.
Stroke because stroke is old now. So he only need to use the late effect code. Late effect. You
Yeah,
need to
second
go, yeah. Sequela is late effect same. So what? How to search? You need to go sequela, because if you go into the late effect, it says that see also sequela. Okay.
Yes.
So I am directly going to the sequela. Okay, sequela and disease cerebrovascular, because we are discussing the CVA. So now here, what condition mentioned in our condition? Um, the condition is not mentioned. Okay. So here you will find all these conditions, whether apaxia, dysphagia, है ना?
Yes.
First, you need to go sequelae and check with disease. Okay. Sequelae is from here. Then we have impending or threatened condition. So just check what mentioned in this table. What you are able to understand from this table.
In this condition, we understand that someone threatened to the patient.
If threaten, if physician mentions threatened condition or impending.
If physician doesn't mention that threaten or
No, no, he mentioned the threaten
okay.
or impending condition.
In this scenario, we are not providing codes.
No, 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 no. So if there is a entry in ICD 10 books, okay, then we will use that code. So if there is a threatened myocardial infarction, we will go infarction, myocardial threatened. If there is a code available, we will use that code. If there is no code available, we will not use myocardial infarction code.
Threatened condition means that someone threatened to the patient. That's why he. वो कह रहे हैं, कल ही
No, no. It's not threaten somebody. It's like he have myocardial infarction condition, which is impending. So the person did not get myocardial infection, like infarction yet. Okay. But it's a threatened conditions. Okay. Check this. Check this in your book. Threatened myocardial infarction. Check whether you are able to find the code for it or not. First, you need to go infarction, then myocardial, then threatened.
We need to go guidelines.
No, no, no. You need to search the code in alphabetic index. First, you need to go to infarction. IN. Hmm. Infarction. You need to go in infarction. Okay, I will show you on my system.
Okay, nice.
No, no, it's a very simple. Na infarction. IN.
IN, I am here, IN only.
You are in
Incident and legal.
external cause. You need to go into the disease index here. You are searching in wrong index. Okay, so just see infarction we got. Infarction. Mhm. Infarction we have.
Uh,
Then we need to search myocardial. Myocardial. Got it? Now we need to check threatened is there or not. So I am not getting. Now I need to check threatened. I will go into TH. Threatened. Hmm. Threatened. Hmm. We do not have myocardial infarction being threatened. But the code earlier we have. Okay, let me check this. I 20.0. Because earlier we are supposed to get no under threaten we I am not able to
Myocardium.
mm, mhm. We get in some book this condition under myocardium you get the threaten infarction myocardium. I'm not getting threatened.
Your
Where I get this? Transmural. Mhm. I will check that. Okay. Because earlier there is an entry of threatened. I am not able to find this code. I 21.3. नहीं मैंने कहा मीटर फिगर हो रही है
so
abortive myocardial infarction. Okay.
fraction starts from here.
Okay, got it. Threaten abortion. Mhm. There is no entry. एक बार so we have code. Okay, we have code in impending rather than threatened. Just go into the impending. Impending. Impending myocardial infarction. Okay, got it. Check your see your on your screen. See your in your screen. This impending myocardial infarction I-20.0. Yes. Okay. So we will not able to find into threatened, but we are able to find into the impending. Okay. Any query till now? Okay. And if there is no impending or threatened entry is there, then we will not code that diagnosis. Okay. So if say that impending stroke, okay, no specific code available, then we will not code stroke. We have multiple examples. You can go through these. Okay. You can just review this table.
They didn't mention the code. We only code for disease only, sir.
No, no, we will not code that.
In that
If
case,
if impending or threatened condition is not code is not available, we will not code that condition. In that case, we can code the symptoms.
Symptoms.
Yes.
Condition was rolled out after evaluation.
That is all also not coded. We will not code it. Okay. If code exists, assign it. If not, do not code the disease itself. Only code the symptom or risk. Okay.
When risk factors also your code.
If mentioned in medical record. Okay. General rule. So if you found any these condition, rule out, suspected, questionable, likely, probable, consistent with possible or differential diagnosis, do not code it. Okay. So if somebody say that rule out myocardial infarction, no need to code it. Questionable gallbladder stone, do not code it. Okay. Mm. 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 Yeah.
If we do not code, what should we mention?
Either need to go observation for suspected condition, or you need to code like a sign and symptom. If he has abdominal pain or shortness of breath, whatever sign and symptom you have, you need to code that. Now see this example. Assessment rule out gallbladder stone.
Final impression.
No confirmation of gallbladder stone in imaging. So
Abdominal pain.
only.
Or do not code gallbladder.
Yeah. Now suspected this example.
Suspected or possible conditions. Patient
Suspected liver cancer. है ना?
further evaluation.
Final diagnosis.
function test. Normal basic. Do not cause liver cancer. Means the analysis of needs organ. I didn't understand this example. It was, can you please explain?
Patient has suspected liver cancer. So we will not code it.
Suspected.
Yeah.
Final reporting will be abnormal liver function test.
Yeah. So these are the other diagnoses in medical record. So we will code these. And if we say differential diagnoses are, that are also not coded.
Test when if documented. Do not go.
Mm-hmm. If it's documented, then only code.
Yes.
So above is also mentioned, if documented, then only code. If abnormal lab results are present, then only code. Okay. This is what not to code a diagnosis, है ना?
Suspect possible likely differential diagnosis.
Negative imaging or lab results, है ना?
In this scenario, we are not supposed to go.
Yeah. What we need to code? In that case, symptoms or any abnormality is there. Okay. Key takeaways, always code what is confirmed. Yeah.
The diagnosis is uncertain, code symptoms, normal test results, or risk factors. Do not code a condition that is ruled out, suspected, or only listed in a
Differential diagnosis. Okay. Any query you have till now? No. If physician mentioned left and right,
Okay.
and we have a code for that, we always need to provide code for left and right. Or if there is a bilateral code available, we provide the bilateral code. So suppose if physician mentioned left as well as right, but there is no combination code available for left and right. So what we need to do, we need to provide code for both left as well as right. But if there is a combination code available, then you cannot provide two code. Okay. Just go through this guideline.
Written codes include lettability. It is essential to design the correct code based on documentation. The physician specifies left or right, use the corresponding left right code. The physician specifies both checking for bilateral code is available. A bilateral code exists, use only bilateral code. If no bilateral code exists, use both left and right codes. Physician does
No specify laterality, query a provider to clarify. Okay.
Yes. Only for knee pains, specific codes are available.
No, every whenever, whether it's a shoulder, knee, hip, if there you have two organ in your body, like left eye, right eye,
Yes.
right ear, left ear.
If physician documentation, right knee pain and left knee pain. In this case,
You need to provide code for both. If there is no combination code available.
okay. If combination code available,
You need to, so now here they check this carotid artery.
That,
bilateral code available. So do not use left and right code. You have bilateral code. Okay. Any query?
No, sir.
Now? Enough for today, or you want more? Then you can continue with the yesterday task. Okay, now you can uh, find the valid codes.
Yeah.